Hi there, my name is Catherine Lindgren, and this is my head-to-toe assessment. This is my ID for verification. And I'm going to show you the room. This is my patient. This is my dining room. The only things I have out on the table are my instruments and my OneNote card. All right, and I will begin my head-to-toe assessment. Hi, Scott. My name is Katie. I'm going to be your family nurse practitioner today, and we're going to be doing a head-to-toe assessment. Do you have any questions before we begin?
Nope.
Okay, great. I'm going to start off with a few questions for you. Can you tell me your full name and date of birth?
Scott Andrew Lindgren, 11/28/1978.
Good. And can you tell me today's date?
August 3rd, 2016.
Perfect. And can you tell me what room we're in or what building we're in right now?
In a house.
Okay. And can you tell me who the current president is?
Is Barack Obama.
Okay, very good. And how are you feeling today?
Good.
Good. So Scott is alert and oriented times 4. His speech is fluent and clear. He states that his mood is good, and that appears to match his affect. He's dressed appropriately for the situation. I'm going to go ahead and start with your head. So when I'm looking at the head, I'm looking for symmetry. Ears, eyes, nose are all symmetric. I am looking. I'm looking at the hair distribution on the top of his head. It is evenly distributed. No obvious or overt signs of infestation. I'm going to go ahead and look through the hair. Can you bend over a little bit? There we go. So no signs of infestation. I'm palpating. Is any of that tender?
Nope.
Okay. So no masses or nodules or lesions noted. Looking at the eyebrows, they're symmetric over each of the eyes. Hair is evenly distributed. Looking at the eyes, the eyelashes are evenly distributed above both eyes. The sclera is white, conjunctiva is clear. The pupils are light blue, and the irises are light blue, and the pupils are round and equal. Okay, we're going to I'm going to palpate your eyes here. Can you close for me? Great. Was any of that tender?
Nope.
Okay. We're going to test your vision now. We're going to use the Snellen chart. It's going to test for distant central acuity. So we have the Snellen chart behind you. So if you would stand 20 feet away. I'm going to have you cover your right eye. And if you could, please read the lowest line possible.
DFN FTH.
Okay. And now cover your left eye. And read for me the lowest line possible.
PHUNEOA.
Okay. And with both eyes, can you tell me which one you can read the best? Or the lowest line down?
DFNPTH.
Okay. So you have 20/30 vision in both eyes. You have 20/30 vision in your left eye, and you have 20/20 vision in your right eye. So you can come back and sit. Another vision test we could use would be the Rosenbaum, and that would be for near central acuity. And what I would do was use a ruler to measure out 14 inches, and I would have you read the lowest line, and we'd be able to determine your vision that way as well. I'm going to dim the light so that I can do some more assessment of your eyes. I'll be right back. You still see? Okay. So if you would, look straight at my nose. I'm going to shine a light right in the middle. Very good. And we've got corneal light reflex. And I'm going to test now for direct and consensual reactions. So I'm going to shine the light into your left eye. And I'm noticing that the left eye is constricting as well as the right eye. All right, and same happens on his right eye. The right eye constricts as well as the left eye, and that's direct and consensual. I'm going to, where's my pen? I'm going to check for accommodation now. And what I'm going to do is I'm going to have you stare at the pen. I'm just going to have you watch it all the way into your nose. All right. I was testing for accommodation. Pupils constrict as the pen moves closer to your nose. And we'll test for EOM. We're going to test your eye movement. So if you would, just follow the pen and follow them with just your eyes and not the rest of your head. Good. And he has great movement in all 6 cardinal fields. And I'm going to do a test called cover and uncover to test for nystagmus. I'm going to cover one eye. And you can just pick a point in the distance to look up. Okay. No nystagmus noted. And no nystagmus noted there either. Okay. And I am going to take a look into your eyes now. I'm going to have you look straight at my earlobe here. I'm going to examine your right eye, so I'm going to use my right eye to examine yours. Sorry, if you could come a little closer here. There we go. So I'm going to shine the light into your eye. I'm going to brace to make sure that I'm not coming too close. Once I see the red light reflex, I'm going to move in. I see the optic disc. It's round and well defined. And I saw no hemorrhages in the vessels. So again, I'm going to do the same thing on your left eye here. I'm going to examine with my left eye. I'm going to brace to make sure that I don't injure your eye. I'm going to look for the red light reflex. And as soon as I see it, I'm going to move in. The optic disc is round and well defined, and no hemorrhage is noted to the vessels. All right, you doing okay?
Yes.
All right. All right, so we're going to move on to your nose. And I'm going to have you plug one nostril and take a deep breath. Very good. And we'll switch to the other side. Very good. Looking at the nose, it's symmetric. Both nares appear to be patent. I'm going to feel your nose here. No nodules noted. Was any of that tender?
Nope.
Okay, very good. All right, I'm going to use a clean speculum. We're going to take a look here inside your nose. Oh, sorry. going to place the speculum and and brace so that I don't injure. Turbinates are pink and moist. No nodules noted. Do the same thing here, bracing to make sure that I don't cause any harm. Again, turbinates pink and moist and no nodules noted. I'm actually going to have you, while we're doing this, going to check for the maxillary sinuses transillumination. So if you could open your mouth for me. Very good. Whoops. Well, I guess we don't need that hearing.
Sorry. It's back there.
That's fine. Okay. Very good. And I was able to see into his, it was transilluminated into his mouth, so I could see all of that. Oh, wait. Sorry, our computer is giving us some problems. Are you serious? Okay. Okay. All right, we're going to move on to your ears. So I'm looking at the ears. They're symmetric to the head, equal to the corner of his eyes. I'm going to go ahead and palpate the ears for any masses or nodules. Was any of that painful?
Nope.
Do the mastoid process. Was that painful?
Nope.
Good. Okay, I'm going to get a clean speculum, take a look inside of the ears. I'm going to pull the pinna up and back for adults. I'm going to place it inside the ears, bracing with my pinky to make sure that I don't injure. The canals are clean of debris, no erythema. Tympanic membrane is pearly and silvery white, again, no purulent drainage or oozing noted. All right, pulling the pinna up and back, I'm going to place the otoscope into the ear and brace with the pinky so that I don't injure. All right, and the tympanic membrane is pearly and white. In the external canals, there's no drainage and no debris noted. I'm going to test your hearing. So if you could please cover your right ear. I'm going to stand behind you. I'm going to whisper a word. If you can tell me what I say, please.
Baseball.
Okay, good. And if you'll uncover your ear and cover your left ear. Apple pie.
Apple pie.
Very good. Okay. I'm going to bring the lights up a little here. Okay. And if we had a tuning fork, I would strike the tuning fork and place it in the middle of the head. And I would ask you to tell me whether you heard the vibration in one ear or better or the other, or if you heard them equal in both. I could also do the Weber test, where I would strike the tuning fork, placing it on the mastoid process. Wait till you tell me that you didn't hear it, and then move it around to the side of the ear. This is testing for conduction and hearing loss, and that's the Ryan and Weber test. All right. So I'm going to now palpate for for your lymph nodes. I'm going to start in the back here with occipital, preauricular, postauricular, tonsillar, submandibular, submental, posterior cervical chain, anterior cervical chain. And if you could scrunch your shoulders up for me, relax just a little. Supraclavicular. Do the axilla. Epitrochlear. And the axilla. The epitrochlear. Were any of those painful at all? Tender?
No.
Okay, good. And none were palpable or enlarged. So now I'm going to move on, excuse me, to the neck. Examining the neck, trachea is midline, no thyroid masses noted, no thyroid megaly noted. I'm going to test your thyroid now. I'm going to give you a glass of water. If you will take a sip of water and hold it in your mouth. Okay, I'm going to have you tilt your head to the side and look down a little bit. Not all the way down. There we go. And swallow it for me. Very good. No thyroid nodules noted. Also, the thyroid cartilage moves up when he swallows. Go ahead and take a sip and hold it there. And swallow. Very good. Thyroid cartilage does move up when he swallows, and again, no masses noted. So I'm now going to listen with my stethoscope, with the bell, to listen for any bruise. Okay. I'm also going to palpate the carotids. And listen to that as well with the bell. No bruit noted to the carotids or the thyroid. Carotid pulses were 2+ bilaterally. Okay. And so now I'm going to have you take your shirt off. I'm going to inspect your chest. So I'm looking at the chest. Chest is symmetric. Skin is even. Hair distribution is even and symmetric. I don't see any heaves or any lesions. I'm going to go ahead and palpate for fremitus. So I'm going to put my hands on your back. I'm going to ask you to say 99 as I move down your back, and I'm palpating for tactile fremitus.
99, 99, 99, 99, 99, 99.
Very good. Go ahead and say it again.
99, 99, 99, 99, 99.
And the fremitus was equal all the way down. I'm going to go ahead and percuss. Can you lift your arm up for me? Sit up this way for me. There you go. Okay, gonna move on to the back. I'm percussing the back. Okay, can you move forward in your seat just a little bit? Okay. And resonance is heard in all lung fields. I'm going to go ahead and auscultate the lung fields. I'm going to start by listening here. Can you take some deep breaths for me? So bronchial lung sounds are heard. Bronchovesicular sounds are heard here. And vesicular sounds are heard in the periphery. I'm going to move to the back. Okay. Lung sounds are clear in all fields. No crackles, bronchi, or wheezes noted. I'm now going to assess your heart. Looking here, I don't see any heaves. I'm going to palpate the precordium. I'm going to auscultate first with the diaphragm for the heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and then mitral valve. And I'm going to listen here for a full minute, and I'm going to count your heart rate. Apical heart rate is 59 beats per minute. Oh. Now going to listen with the bell. Going to listen for any heart murmurs. No murmurs or splitting noted. I realized I didn't do respiratory rate previously when I was assessing the lungs. I'm going to go ahead and do that now. So if you'll just breathe normally, I'm going to assess for your respiratory rate. Okay, respiratory rate is 14. Again, even and unlabored, no signs of distress. So going along with cardiac function, we're going to palpate the blood vessels. Going to start with temporal, carotid, going to move on to brachial, radial, okay. Let me see your feet here. Posttibial. And then pedal pulses. Pulses are 2+ throughout, regular, rate, and rhythm. I'm going to go ahead and check the skin. It's warm to the touch. Skin turgor has instant recoil. No tenting noted. I'm going to look at your nails. Nails are short and well kept. Skin refill is less than 2 seconds, or cap refill, I'm sorry, is less than 2 seconds. I'm going to go ahead and look at your nails. If you would do this for me, we're going to match up your nails. We're going to look for clubbing, just one at a time. Perfect. Very good. Very good. Very good. Angle is about 160. No clubbing or infections noted. I'm going to check your feet here. Check for capillary refill. Skin on the feet's a little bit cooler. Cap refill is still less than 2 seconds. Okay. Now I'm going to assess your abdomen. I'm going to have you lay down here. I'm going to move the camera so that you can see what we're doing down here. Okay. So first I'm inspecting the abdomen. Abdomen is flat. No obvious pulsations. No scars. I'm going to listen first to the abdomen. We're going to listen for bowel sounds. Vowel sounds are active in all 4 quadrants, and no aortic, abdominal aortic bruit noted. I'm going to percuss. Sorry, it's hard to get to a good position. Timpani felt in all 4 quadrants. I'm going to percuss for liver span. I'm going to start at the umbilicus and work my way up. Okay, and I'm going to mark where I feel the dullness. Start up and go down. And I have the liver span at 6 centimeters, which is within normal limits between 6 and 12. Palpate for the spleen. I'm sorry, I'm saying palpate, I mean percuss. Spleen is noted between the 6th and 10th intercostal. Now I'm going to do a light palpation. I'm going to do all 4 quadrants. Are any of these areas painful?
No.
I'm going to do a deep palpation. And were any of those areas painful? Okay. I'll have you sit up. Just stay there for a second. I'm going to check for CVA tenderness. Can you tell me if this is tender? Is that tender? Is that tender?
No.
Okay, no CVA tenderness noted. Okay. So if you want to go ahead and stand up for me, I'm going to take a look at your posture and your gait. Posture is erect. And if you could turn around for me, I'm going to have you bend over and touch your toes. Okay, and stand back up for me. Following the vertebra, making sure that everything's in alignment. Shoulders, hips, everything seems to be in alignment. Scolio test would be negative. And can you go ahead and walk to the end of the room and back for me? Very good. Walks with a steady gait. Move this back just a little bit. All right, you can go ahead and put your shirt back on. Okay. And if you want to move the chair here, I think this would be a good spot. Go ahead and have a seat. Okay, so now we're going to test your cranial nerves. Cranial nerve 2 is the optic nerve. It's sensory, and that is intact as evidenced by the Snellen and Rosen chart. Cranial nerve 5 is trigeminal. That's sensory and motor. So I'm going to have you, to show the motor aspect, I'm going to have you clench your teeth. Clench down. Very good. And do you have any problems with distinguishing between sweet and salty?
No.
Very good. Okay. We're going to do the facial cranial nerve. That's number 7. And that is also sensory and motor. Going to have you raise your eyebrows. Very good. Close your eyes as tight as you can. Can you puff out your cheeks? Very good. And now whistle. Very good. I'm going to have you I'm sorry. Cranial nerve 8 is the auditory, and that is sensory, and that is done or intact as evidenced by doing the whisper test earlier. And cranial nerve 9 and 10 are glossopharyngeal and vagal, and those are sensory motor. The glossopharyngeal is intact by having the uvula rise and having no problems swallowing. Excuse me. The vagus is intact, as evidenced by that as well. Do you have any problems distinguishing between bitter and sour?
No.
Very good. Okay. We're going to test your spinal accessory muscles, and that's going to be cranial nerve 11. And what this is we're going to test the trapezius and the sternocleidomastoid muscle. And so I'm going to have you push against my hands. Very good. And the other side? Very good. And try to push your chin down to your chest. Very good. And how about extending your back or neck all the way? Very good. Okay. So that one is intact. The hypoglossal is motor, and that's going to be distinguished by tongue movement. So I'm going to have you stick your tongue out. Try to touch your nose with your tongue and your chin. And can you move it from side to side and up and down? Okay. And I'll put your tongue in your cheek and try to push against me. Very good. Tongue in cheek, try to push against. Very good. Okay. Now we're going to test your range of motion. So we're going to do active and passive. First, I'm going to have you do the cervical, do your cervical region. I'm going to have you flex and extend, hyperextend. Very good. Can you rotate from side to side? And can you bring your head laterally? Very good. And I'm going to do it passively here. Flex, extend, hyperextend, rotate, and lateral. Okay, very good. I'm going to have you do your shoulders next. Have you put your shoulders out front and then out to the side. Go back. And now if you'll do a circle for me. Watch the light. Okay, very good. And we're going to do this passively on each side. Okay. Very good. I'm going to have you do your elbows now. Flex, extend, and rotate. Okay. I'm going to flex, extend, and rotate. Flex, extend, and rotate. Going to do your wrists now. Flex, extend, or hyperextend, and then move forward. There you go. Flex, extend. Okay. Okay. Now we're going to do your fingers. Flex, extend, abduct, adduct. Okay. Flex, extend, abduct, adduct, flex, extend, abduct, adduct. Okay. I'm going to have you do it with your hips. I'll have you stand. You flex, then extend, then just kind of circle. All right. Flex, extend, and circle. Okay. I'll have you have a seat. All right. Do your knees. Knee flex, and extend, and then flex, extend, flex. There you go. And then I'm going to have you do, extend, flex, extend, flex. I'm going to do your ankles as well. So I'll have you bring them up, point them, turn them in, turn them out, and then just kind of rotate. All right. Up, down, rotate. Okay. Flex up, down, ankle popped, and rotate. Good. So as active and passive range of motion in all joints. I'm going to go ahead and take a look at my note card just to make sure that I have hit all of the areas that I need to. Give me just one moment. Okay, I did forget to do a couple of tests, and I was mistaken on the cranial nerve. The salty and sweet is going to be for the facial nerve and not the trigeminal. I'm going to have you, if you could, lay down, please. We're going to do a few of the tests. I did a few of the additional tests. I did the maxillary transillumination. I explained the Ryan and the Weber test. If you could scoot all the way back to where your heel is on the, just bend your knee, I'm sorry, at a 45-degree angle. Sorry. All right, what I'm testing for here is this is the drawer test, and this is testing ACL. Very good. There's not much movement there, so ACL is intact. Very good. I forgot the McMurphy sign. Murphy sign, not McMurphy. Murphy sign, excuse me. Oh, I'm going to readjust. Just going to test for gallbladder. I'm going to have you just pull up your shirt here. All right, I'm going to press here. I'm going to have you take a deep breath. Any pain there?
No.
Okay. I'm going to wrap my fingers around your rib cage here. Take a deep breath for me. And any pain with that?
No.
Okay. And that's testing for gallbladder and liver pain. And that was negative on both of those. Oh, I didn't test for coordination. So I'm going to have you stand. Can you? Okay. I'm going to have you close your eyes, and I'm going to look for any swaying that may be happening. And I'm not seeing any swaying. Go ahead and open your eyes. Okay, so that's testing for coordination there. I'm going to go ahead and have you put your arms out to the side.
Hear that?
Yeah. And touch your finger to your nose, one at a time. And I'll go ahead and close your eyes and continue to do that. Okay, good. Can you go faster? Okay, very good. I'm going to have you take a seat here. And I'm going to have you on your lap here. Just rotate your hands. And go ahead and close your eyes. And go as fast as you can. Very good. And if you could close your eyes, and I want you to touch your fingers with your thumbs with your eyes closed. Very good. Okay, coordination seems to be intact. Oh, I did not test for sensory. Okay. On your face here, this is the facial nerve. We need to test for sensory. So I'm going to give you an idea of what each of these feel like, and then I'm going to have you close your eyes, and I'm going to touch you on a part of your face, and I just need you to tell me if it's dull, sharp, or soft.
Okay.
Okay? This is dull. This is soft. And this is sharp.
Okay.
Can you tell the difference?
Yes.
Okay. Go ahead and close your eyes for me.
Sure.
Very good. And what part of your face did I touch?
The left cheek.
Okay.
Dull.
Let's try it again.
Soft.
Correct.
On my right forehead.
Okay.
Dull.
And where was that?
Right cheek.
Okay. I'm going to have you keep your, keep your eyes closed. I'm going to do the same thing but on different areas of the body. So if you could tell me which areas I'm touching. Okay? And with which, soft, dull, or sharp. Okay?
Sharp right arm.
Very good.
Dull left arm. Soft right foot. Sharp left calf.
Okay, very good. And if I had a tuning fork, I would strike the tuning fork. I would ask you to close your eyes. And I would place it on body parts to see if you could feel the vibration. I'm just realizing that I did not inspect the mouth. I do not know how I forgot that. But we are going to inspect the mouth. Not sure how I left that out. But I am looking at the mouth. Mouth is symmetric. Lips are pink and moist. Can you smile for me? Smile. Smile is symmetric. Can you open your mouth for me? The first thing I'm seeing is the tongue. Tongue is pink and moist. Looking inside. Gums are pink and appear healthy. There are 32 teeth. Some cavities noted to the second tooth from the back. Okay, and can you, lift up your tongue for me? Okay, frenulum is intact. Excuse me. I would wash my hands. And can you open your mouth for me? Okay, stick out your tongue. And can you say ah?
Ah.
Very good. Stick out your tongue a little bit further. Say ah one more time.
Ah.
Very good. Tonsils are 1+, no erythema or signs of infection. Uvula rises with phonation. Just trying to go over everything in my head, make sure that I have everything that I needed. Can you think of any stone I've left unturned?
No, I think you've got it all.
Okay. And again, my name is Catherine Lindgren, and this was my head-to-toe assessment. Thank you.